Welcome to Peak, Train Like a Girl, a podcast by girls in sport, for girls in sport. We're here to amplify your voice. We think it deserves to be heard. I am so glad to be back here with Danielle. Danielle, I think we're on week 3, right?
Yes, I am so excited to be back with you too. And I love who we have prepared today. So it's going to be a good one.
Yeah, absolutely. All right, a couple things. Is the heat and humidity getting to you, or is it just me?
Oh, it's getting to me. It's getting to my husky, who is very confused, like why she cannot, cool down enough. But I kind of like it. It's like a cozy blanket.
That's so funny. I have to tell you my funny running story. So this morning I was out running and I'm trying to figure out the best app to be on for me, either Garmin or Apple, mostly because I'm tracking miles for my athletes for summer running. So I'm getting, their courses set up or whatever. So anyways, I'm on my Apple Watch today and I was sweating so badly it thought I was drowning. So it shut my watch off.
Oh my gosh. That's when you know the humidity is real.
That's real life. That is, that's when you know the humidity's bad. All right. I've got one more thing too. I've been trying to, how it's a little harder to find nutrition in the heat because your body just isn't you just don't want to eat as much in the heat, but we know that it's so important. So I tried this new thing today in my pancake batter. I don't love the taste of protein powder in my pancakes, but I know after a workout I need a little protein. So I added cottage cheese in today and mixed it up really good and then made pancakes with that. Have you ever done that?
Yes, cottage cheese is so versatile. I've used it in dips. I've used it in, I can't say smoothie necessarily, but the way you're doing that with your pancake batter, I do similarly with Greek yogurt.
Yum. Yeah, it's so versatile. You're exactly right. It can play any part.
Yes. I put it on avocado toast. It is the end all be all. It goes with everything.
I agree. I don't love the texture on its own, but when it's in something, I like it.
Oh, I could go either way.
Okay. All right. So if you've learned nothing else from the podcast today, you learned how versatile cottage cheese is.
Yes.
So anyways, we are over the moon, thrilled, delighted to be talking with Simply Be Counseling today on the podcast, specifically, and I believe it is the owner, Audrey. Audrey, thank you so much for being here with us today.
Thank you. You guys are so fun to listen to already.
Oh my goodness. I'm glad you're settling in. Now, we didn't really prep you for this, but we do this really quick warm up. So I'm going to ask you a either or question. This isn't rocket science, so you don't have to be prepared. Just whatever comes to your head. You ready?
Yes.
All right. Beach or mountains?
Oh, I just had this thought yesterday looking for artwork for my living room because I want a landscape, and I was trying to decide between a beach landscape or a mountain. Okay, so for the sake of this conversation, I'm going to say mountain because I had an epiphany on a mountain and decided to open Simply Be.
I love that.
Yes, I'm going to choose mountain because that's where I saw it all.
All right, I like that, and I like the thought behind the answer. All right, 4-star hotel or camping?
4-star hotel.
Boy, there was no hesitation there.
I love it.
Not a camper.
I love that. All right, our favorite question on the pod is lipstick or lip balm?
Oh, my daughter is going to listen to this. Lipstick.
Oh, I love that. Do we have a favorite color?
I did a color analysis and it told me peach is my color. So I have converted from maroon-ish to peach and I'm pleasantly surprised.
Love that. Well, I can't wait to see it in person. Maybe one day I'll see you in person with your peach lipstick.
Yes.
Awesome. Well, thank you for getting warmed up with us. Now, we'd really love to get to know you a little bit more. Fill us in. What's your story of being a girl in sport?
Yeah, I have been a girl in sport from day one. My mother was a 3-sport athlete in high school. So was my father. And we were raised to do the multiple sports. I grew up on softball, let's see, softball, volleyball, a little bit of track. And I really narrowed in on volleyball as my passion in 5th grade when my teacher's daughter was a University of Illinois setter. And I admired her and she became my kind of idol. And so I said, I want to be like her. So 5th grade, I zeroed in on volleyball, but I still played multiple sports. And then I focused solo on volleyball in high school, my freshman year. And it was really a place for me to focus my energy outside of the friendships and the school or the drama and just really work hard without having to apologize for being competitive and ambitious and loud. And I didn't feel like I had to shrink myself. It's a place where you can be as big and bold as you want to be without having to apologize. So I just found volleyball specifically, to be a way for me to step away from anything going on at school with friends, and really gave me that structure and confidence and a place to be exactly who I wanted to be. And there was no relationship or no drama that followed because every play just moved so fast. And I really loved that. And it gave me a break from sometimes what you can feel as a girl going through school with so much relationship dynamics and drama in the classes and in the hallways.
Yeah, that was absolutely amazing. I love that you talked about being a 3-sport athlete. Here at Peak, we're really big on helping athletes understand that when they're young, they should be experiencing a bunch of different things. I right away was going to ask you to talk about mental health and mental performance, but I actually want to pause there because you talked about something that I wanted to eventually get into, but since you brought it up, I'm going to talk about it. So I'm with you. Sport to me often supports mental health, but what do you think happens when we find athletes who actually are struggling or sport actually becomes a trigger, to mental health issues? Because I'm with you. I think it should be something that's enhancing our overall well-being. But what do you talk to your clients about, or what are some of your suggestions when you find that sport is actually the trigger?
I think one of the things is to step back, and whether it's sport or anything that you have in your life and you're questioning it, for example, maybe you're questioning a friendship or a boyfriend or a girlfriend. If you step back and you ask yourself, is the duration of this problem, has it been going on for a long time, or is this just a hot moment? And is the intensity of this intense all the time or just a hot moment? Because sometimes we can catastrophize and think this one moment is why I want to quit the sport. But when you step back, you realize that it wasn't frequent and it wasn't intense very often. But I like people to step back and be more patient and look at it from a bird's eye view and decide, how long has this been going on and how intense is it? And then making a really proactive choice of, okay, well, if this is a mental health issue for me, maybe in a week I talk to my coach, or maybe next season I don't return, or maybe in a month I talk to my coach. But I try to delay and slow things down so that people don't get too emotional in their decision. So I like to mix that subjective emotion, which is really important to listen to, but mix it with an objective step back and just try to find a balance, because I find people rush to a solution to resolve that anxiety too fast. And so I try to slow that train down.
Yeah, that's really helpful. And I love that the words you used. I love that you talk about a hot moment. I love that because that's so relatable to the demographic we're talking to. And the idea that we can over catastrophize something, which, by the way, for me, who can't do that? It's kind of fun in the moment to do it, but then to also recognize when you're catastrophizing something and take it back 3 steps. Do you have a timeline that would be helpful for an athlete or a coach or a caretaker, or is it individual, or does that not exist? When do you know it's time to seek help?
That's a great question. So if there is a consistency day to day, or there's more days than not that are not good, or what you'd say, I'm having a bad day. If you have more bad days than good days, week after week, that's a time to get help.
Awesome.
Yeah.
Danielle, you want to jump in here?
Yeah, I really love, Audrey, that you had pointed the time frame piece out because that allows us to zoom out a little bit from being so in the emotional turmoil of whatever the experience is. And I think, whether it be in sport or relationships or certain class loads is when we're having more, bad days than good. It is a time to be honest with ourselves and go to a support person we trust, whether it be that coach, a family member, a friend, and talk it through that this is something you're finding is bigger than you at this point to navigate or problem solve.
Yeah. Can
I
we
guess,
can we circle back for a minute and just before we get any deeper, because you are both adding so much value here and you both have an expertise. So I would like to take a minute to talk about the difference, or maybe even it's a definition, mental health and mental performance. So Audrey, why don't you start and just kind of what is a definition, or is it a definition, mental health? And then Danielle, maybe you can fill us in on one for mental performance.
Yeah, I think mental health is really the foundation. It's the nuts and the bolts of the engine. So what is happening on the deeper level that will eventually surface and show up in performance? But if your big four, as I call it, your thoughts, emotions, physical sensations, and urges are not an awareness, then your nuts and bolts are not going to run at an optimal speed and you're not going to get an optimal output. But if your big four is aware, you're aware of it, you are objectively kind of looking at it and you're processing it and you're experiencing it, that I think is a well-oiled machine. And then that is the foundation to then rev up an output. But a lot of times people will call Simply Be for performance, yet we uncover very quickly that there are anxieties that are causing sleep disturbance, causing school avoidance or social avoidance or catastrophizing and a sense of panic. That's mental health. So we put one first, and then once the nuts and the bolts and the mental health are in a good place, then the performance kind of kicks into gear.
Danielle, before you fill in, what are the big four again? Thoughts, just tell me the big four again.
Yeah. So what I do is I imagine, I put a hand in front of my face with 4 fingers. That's the big four. And I think about looking at my hand with the 4 fingers up. It's a thought, emotion, physical sensation, and urge. And if I'm looking at my hand and I can say what those 4 things are in the moment, I'm aware. But if I put that hand behind my head and I can't see that, that's not awareness. And that's the problem, is that we don't know what's going on internally. So I always have people take their hand and then look at it and think, okay, if you see that, that's self-awareness, that's mental health 101. From there you can work with it. But oftentimes, like driving a car, like road rage, like we have our hand behind our head and we can't see our big four. We don't know what's going on. So we're more likely to either numb out or avoid our feelings, or they can kind of hit you out of nowhere. So I prioritize self-awareness in mental health as my sub-zero level of entry. Like that's where I start with everyone, and then I'll scaffold after that.
Love that. Danielle, fill us in, mental performance.
Yeah, well, jumping off, Audrey, what you just described of the big four with the mental health 101, I love the 4 fingers in the front, put them in the back, that self-awareness is gone. It reminds me of the interoception that a lot of athletes do have well developed. And so that awareness of knowing when we're hungry, knowing how our heart's beating, knowing when we're feeling dis-ease and why. And if we don't have those fingers in front of us, we can't get to the mental performance piece. But I agree with you. A lot of times client athletes might seek out help initially, automatically thinking this is a mental performance issue, when the mental performance is struggling, but it is a byproduct of the mental health piece. It's not set. And if it's not set, everything built on it is just going to crumble and not be as sturdy. And so for me, mental performance, I love that you put the nuts and bolts at play with that terminology. I talk about mental performance like the brain and the mind, and the brain really is the hardware as well as the mind is the software. And so with mental performance, we are coding exactly what kind of software we're going to download to the hardware. And so all of us are born with skills. We all have skills, and those are mental performance skills, whether it be, self-awareness or patience or breathing or forecasting or, motor imagery, visualization, things like that, changing up the narrative. Those are skills. But when we're struggling with our mental performance, we often either are using tools that are ineffective or we don't know any more new tools to use. And so once your mental health is in place, I think for most, client athletes, at least we work with at Center for Creative Growth, then we can lay the groundwork for tools and teach them, implement them, monitor them so that they become the set skills that are being utilized properly to the athlete's, desire.
Yeah, I think that's really good. And I appreciate you both kind of going in tandem there, because I think it's really important that people understand the difference, how they can work together. Mental health and mental performance can, support each other, but to understand the difference between the two of them. So Audrey, what would be one or two tips or strategies that you would give a coach or a caretaker that thinks an athlete is struggling with mental health issues?
Well, there's a metaphor that I use that I think has been helpful a lot of the time, and parents can use this directly with the athlete, so it translates really nicely, which is if you imagine two trains side by side. One is a symptom train, anxiety, depression, restrictive eating, poor sleep hygiene. That's a symptom train. And then you have a support train next to it. If your symptom train is going 50 miles an hour, we need the support train to be 50 miles an hour. If your symptom train is going 250 miles an hour, yet you only have a friend and a mom, that support train's not enough. You have to speed up the support train. How do you do that? Counseling, a physician's check, maybe a sit down with the coaching staff, maybe taking a little bit of a break from the activity. So you want to think about the symptom train needs to be matched with the support train, and then that support train kind of catches up and then ideally helps slow it down. So as the symptom train reduces and gets better, the support train drops. So that way athletes are still autonomous and they're individuals and they can be on their own as soon as possible, but that trains need to match. We oftentimes will get a mix match, and the longer there's a mix match between the symptoms are too fast and the support's not enough, you tend to get an acceleration of symptoms, which then can cause more symptoms and sometimes more intensive treatment, which may cause the athlete to be in more counseling sessions and more doctor's appointments. So early prevention's better to prevent intensive treatment is the approach that I take.
And do you see clients now? I'm just curious. Do you see clients virtually, in person, both? How does it work at Simply Be Counseling?
We have weekly therapy. We have weekly dietitian, med management, and psychological testing for ADHD and such. And then we also have a partial hospital program and intensive outpatient program. And so we match the level of care and support to the symptoms. So if someone's symptoms are going, let's say 200 miles an hour and they can't get to school, they can't do homework and they're falling behind, or they have a panic attack before they go to school, we have a partial hospital program that they can attend about 30 days of treatment in place of school until their symptom train is slower, and then they return to school. So we do intensive services all the way down to your traditional therapy.
Awesome. That's super helpful. So you talked about either a nutritionist or registered dietitian, I can't remember, being on staff. So since you brought that up, I'd love to sift around the conversation of eating disorders, and maybe even explain eating disorders. Do you think there's a difference between eating disordered and disordered eating? And again, when it would be time to seek professional help. And then I'm also super curious of your understanding or maybe even your professional opinion of harmful patterns of exercise, whether that's compulsive exercise or exercise addiction and some feelings there. We do, in the sport that I coach, we do see higher incidence of both of those categories, and just curious of some of your professional feedback.
Yeah, of course. An eating disorder is diagnosed and it's based on criteria that is found in the DSM. It could be medical criteria and psychological criteria. So an eating disorder would be something that is impacting people's routine, schedule, sleep, preoccupation, and interfering with normal development, like going to dinner before prom and eating what feels right to you, or you're able to have ice cream 2 nights in a row and you understand that that was within, your social group and your friends and your family. And so you do it, and there's not the shame, the guilt, the fear, or any kind of behavior that you might do, such as like exercise to compensate for what you ate. That's more eating disorder. Disordered eating is more the phrase that we use when we see people's quirks and oddities and tendencies that are a little unusual, but they're lower on the spectrum of severity. So back to that train metaphor, an eating disorders train is going to be a lot faster than a disordered eating train. And the best way to know the difference is to seek advice or consult from an eating disorder trained dietitian or therapist, or even calling a pediatrician and just kind of saying, in a week, these are the behaviors that we're seeing. Is that normal? And it might be, keep an eye on it, or, whoa, let's have them come in and talk about this. It really does depend, but it's not 1 day or 2 days. It would be like 1, 2, 3 weeks over time. How severe and what are those behaviors? That person can kind of tell you, and then you tackle it, whether you tackle it with just a therapist or you tackle it with a therapist and a dietitian, maybe and a psychiatrist who does medication. You can increase your team, which increases that support train based on how the symptoms are increasing or progressing.
And you talked a little bit about the exercise piece. And again, in a sport, like a sport that I coach, so it might not be the same if an athlete wants to spend an extra 30 minutes shooting free throws to improve their free throw shot, wouldn't probably have the same impact as an athlete who was going to run an additional 30 minutes, after a 2-hour practice. Do you think that is exercise, is that something that should be a concern, not a concern? Do you see that as, is it addiction, exercise addiction, or compulsive exercise, or are those words or not words?
Those are really good questions. It's about the intention. So it's not about calorie in, calorie out. So a 30-mile run can be the same intention as someone forcing themselves to shoot 100 free throws. The intention is what matters. It's not the calorie output. So if someone is running to compensate for food, if someone's doing 100 shots to compensate for food, that's a concern. And it's a concern because it can be compulsive, it can be ritualistic, which leans towards anxiety, or it could be out of shame and guilt and fear, which is emotional and psychological. So I always want to know the intention. So if one of my athletes says, oh, I had a really big Thanksgiving dinner, I need to go for a walk, it's talking about, is that movement because you feel your digestive system and you feel it's self-care and it feels good? Or is it you feel fat, you think you're fat and therefore you must walk? Those are two key differences.
Yeah, that's a really good distinction. And thank you for talking me through that piece. So it's not a formula thing. It's the intention behind what you're doing. So I think that really was clear for me. And so I appreciate that. Danielle, do you have anything you want to add in here before we move on?
I do. I want to go back to the symptom train, because I think with a lot of endurance athletes or athletes that have a lot of spotlight on the physical presentation of their performance. There, I think, is a big case of a symptom train being invisible symptom, as we talk about losing loss of period, menstruation. And so I know in my career since 2014, clinically, I'm speaking, I've seen a greater awareness of athletes understand loss of period is not a great sign. I am still, though, equally surprised every time I do get in contact with an athlete that still doesn't believe this is something of an alarm or something that just needs to be monitored and be appreciated, that it is a signal of health. It is a signal of, your body's cues of what it's able to take on nourishment wise and what it might be depleted in. Do you find, Audrey, in your work clinically, who you have coming in, to simply be what percent or what kind of generally, like what amount of athletes, I guess, do you think are experiencing REDS, the relative energy deficiency in sport, as they walk in your doors?
That's a great question. So in outpatient, we would be medically screening them to ensure that we didn't have anyone in the red. If we had someone in the red, we would likely work with our program to provide more intensive services. So in outpatient, we would maybe put them in like a yellow zone and have them watch and talk to them about needing a higher level of care. If they're red, we're probably motivating them for a higher level of care, whether that be through labs, through metabolic testing, through just motivational interviewing, like coaching them on like what it means to be more proactive rather than reactive. But in our program, I would say most people are in the red, and that's why they qualify for a program.
And I sense you are one with the metaphors. I already jotted down all the ones you've said already. Do you have a beautiful metaphor you enjoy using to unpack the significance of female athletes maintaining the menstruation, keeping that period going, and why it matters? Do you have a fun way to really unpack the seriousness of that?
Yeah, there's Dr. Daniel LaGrange in family-based treatment for anorexia, or the Maudsley method, as they call it, for eating disorders. He has a couple of metaphors that works with parents to kind of empathize with what they see at home and they just can't believe it. But I think it works for teenagers too, which is you were at one point a soft, warm, gentle little bird. Like there was something in you that was very very connected and very lovely, like a sweet little bird, right? You see a bird on the sidewalk and maybe it's young and you're holding it and you're trying to take care of it and sweet. And then all of a sudden, like this, big kind of scary, like, spider comes and just kind of like lays on top of that bird. And instead of living like the bird, you're living in this, fight with this spider. And you may be so used to that spider that you don't even realize how much it's kind of influenced your bird. But somewhere in there, that bird is there, and that's who I want to see again. That's who I want to support. And when this spider is acting up and it's getting loud and defensive and angry, like I'm not going to engage the spider, because actually I know the original one was the bird. So whenever I hear or see that thing, I'm just like, I'm noticing that that's the other side of you. And like, I'm going to continue to redirect back to the bird. And families really feel that because they know what I'm talking about. And then as you recover from eating disorder and you're not engaging in behaviors, that spider kind of goes away, and they will talk about what it means to have these dual kind of things existing at the same time. And they can relate to that bird as a warmer sense of self, and that spider being a little bit more of the cold, aggressive version. So I try to use things like that to distinguish between these two things.
And same question I asked before, what would be, either some tips or maybe even some, warning signs. I don't know if there's a better word than that for a caretaker coach who could potentially be in a tricky relationship with food and or exercise.
Meaning if the adult is in a difficult relationship with their own food?
No, the athlete is, and what would be ways of coaches or having a conversation with a caretaker, or a caretaker being able to have a conversation openly with a coach about the athlete.
Yeah. So one of the, I kind of go into talking a little bit more about values as opposed to behaviors. So we don't want to get judgmental on people's behaviors about what they're choosing to eat or how they're choosing to move their body, because they'll get very defensive. So when we're talking about people when they're not in the room, we need to make sure that we're staying very non-judgmental and talking about values. So if I had an athlete named Sarah and I was worried about her as the coach, I would go to mom and say, Mom, Sarah is a very thoughtful, intentional girl, and she has always taken really good care of her body. I've noticed that she has started to get more strict and controlling during team meals. I've noticed that she runs an extra mile and has made a comment about because she ate something at lunch. And I noticed that while she's thoughtful and very organized in her life, that might be now going to an extreme and then going to the symptom treatment train. I try to focus on what is really good about that person, yet what has kind of gone off course with them. And usually the personality type is related to the behavior. So if someone is kind of carefree and funny and loud and eccentric and a good time, they might be more risk behavior and causing more mental health problems like impulsivity or a little bit of a manic. So I try to kind of explain, like, this is a great quality of the person and it's going off course right now.
Yeah, it's interesting. And Danielle, I'm curious if this has been your experience also. Typically, I don't have a caretaker come to me with a concern until the athlete isn't performing as well as they used to, which is just, so it's never like they notice a shift in personality or, like I love that, the idea of approaching things like, your athlete is a thoughtful, kind, and generous person. This is what I'm noticing. But it's just interesting that I've been doing this for 17 years, and in the time I've been doing it, when a parent comes to me, it's because an athlete isn't performing as well as they used to, which again, typically will happen if an athlete is underfueled. But Danielle, have you noticed that, or where do you see it pop up the most?
I would say similarly, Anne-Marie, that when I get a client athlete coming to us, whether they be for, mental performance to start, and then my team assesses this is actually a little bit more complex and they need to really, tie down the mental health piece, then they would transition to me for therapy or we refer out. But it usually also, unfortunately, seems to be when the performance all of a sudden really takes a nosedive. And usually that's found out through the visual representation of their underperforming, like, compared to what they were doing before, or they are describing they're not doing great. They don't feel, light, fit, and fast when they're running. They feel sluggish, heavy, drained. We go get a blood test. We see that they're anemic, and then that opens the door to other conversations around lifestyle choices. And then we see a bigger conversation. But I would love if it turned a little bit and we got, coaches and parents and athletes together to really observe the beginning points of maybe some disordered eating that may be influencing different switch in values or, again, priorities, because that definitely would prevent us, digging that hole deeper and having more loss of seasons and lost time in their athletic career. And it's always even a bigger heartbreak because, especially specifically with, certain individuals, whether you be a flyer or a gymnast or, again, a runner, you might be performing really well with some of that disordered eating, masked or not, displayed to others, but then it tanks. And when it tanks, like that heartbreak and building back from that, building back the iron, building back bone density, it can take months, if not years. And I've unfortunately seen that happen. So I would love if we can get in the door quicker to, whether it be clinically or whether it be opening up to, caretakers and support people for just talking about that all of a sudden that the tendency of where our priorities lie have switched.
The actual kind of reality that research and people have seen to support your point is that performance will improve at the early stages of an eating disorder because for a short period of time, the control and the regimen does increase performance. So it's very confusing and tricky that someone's performance can not only be normal and then drop, it actually can improve before it drops. Mm-hmm.
And I think that
the interesting piece of that performance piece then too is that it could be a blood test like Danielle said, because that's sometimes how I've had athletes, start to want to get more information. Sometimes it manifests in a stress fracture. Sometimes it is a physical, but the interesting piece that you said too, Danielle, because then that's where I come in is that road to recovery. And people don't get that, but to come back from a stress related injury is a 6 to 12 month process. It's a long time and even more difficult when an athlete is in period recovery and also trying to come back to athletics. It makes things more tricky. So I'm with you. One of the things that I started a few years ago is that I hand out in my parent meeting a period tracker that my company developed. And the reason I did it on paper is I want to encourage kids to get off their phones, A. And B, a lot of the period trackers that are out there are tracking for either fertility or sexual pleasure, and that's not very helpful to our athletes. And so this is really tracking periods. And one of the things that's super interesting is that most athletes prior to doing this would tell you that, yeah, I feel terrible exercising during my period. But when they actually start tracking it, they actually realize that they feel pretty empowered when they're menstruating. Like that's not when they feel off. So it's just a very good way to really understand the intimacy of their body and how it works. And going back to what you said, Audrey, in the very beginning, is that athletics gives us the opportunity to be big and to speak our mind and to show up. And it goes back to that. It gives them ownership and autonomy and power and more control. And so I think for me, Danielle, that's been something that's been super helpful is that I proactively, when these kids are coming in, as young girls, their freshman year, I'm talking about these things and I'm handing them out and I talk about fuel and I talk about, eating disorders is not a shape or a size. I think that gets us into a lot of trouble. So those are just some things that I think have been helpful. I'm curious, Audrey, what do you think are some other tips that you can give caretakers that give them more opportunity to show up as a parent instead of a coach? One of the things I'm seeing, and Danielle, I'm also curious if you're seeing this, is that parents are also trying to show up as their kid's coach and they're not really showing up as their kid's parent. Not every parent, but I see this more often now than I did even 5 years ago.
Yeah, don't. Your job is not to be the coach. And the car ride there, the car ride after, It's everything but the performance. It's how did it go chatting on the bench with your buddies? Did you like the blue Gatorade versus the purple Gatorade? I saw the ref talked to you a little bit while you were shooting a free throw. You know, you guys smiled. What was that conversation like? We should probably eat some protein when we get home. What are you thinking about dinner? It's everything except performance, because the opportunity to be a parent and to show them that you love them unconditionally is more worth that time, that short period of time that you have with them, compared to trying to give them techniques and skills. And at the end of the day, your kid's talent and ability is not going to be changed by you coaching them. They're not going to dramatically improve by you giving them tips and tricks. If anything, it might actually have the adverse effect. So I find the parents coaching, they're taking a huge gamble. It's a huge risk, and the payoff typically isn't the payoff that they expect. And so for me, it's an absolute no-go.
Well said. Well said. I also think letting parents off the hook in a very direct way, that the way you unpack that, Audrey, is big, that they don't need that. Like, they don't need to be in that role. And thank goodness. I do believe, because of the social media influence from, TikTok to Instagram to, AI, to be able to Google anything, is we all want to be the expert on everything. And we forget about the sincere role that we already have as, a neighbor, a friend, a coach, a teacher, a parent. Is like, your role is sacred. Stay in your role, because they need you in that role. And when I have unpacked it to parents that way, it's nobody's going to do that role better than you as a parent, and don't let anyone else try, but also let off that other hat, take off that other hat. Is I actually notice a sense of relief, is they need the permission to be told it's okay not to. I think there's a lot of pressure to feel like, for my kid to, go to college and get these scholarships and get these deals and this and that, I have to be their agent. I have to do everything. And I think we tend to forget that we can reality test, that there's also a great deal of athletes that are moving on to do things beyond high school, that their parents are not taking that lead, and it's going to work out.
Yeah, I think a parent has to look inward and ask themselves, what is the value that they're using to coach their kid? Because it would be hard to find the value that is money or agent or college scholarship. The value would be love, support, caring. Okay, do that in a different way. Don't do it in coaching techniques and skills. Do it in all the other ways. And I have a son in AAU basketball, which I have never seen some of the parent behavior as I have in any other sport than AAU. And so I always think, when I'm watching the parents, it's, you're invested, you must love them, but the way that you're loving them right now is getting a counter adverse reaction out of the kids. So you have to step back and just realize that your love doesn't need to be in technique. It can be in all the other ways.
Yeah. And I think any listener here, a coach or a parent, even athletes listening, you would be surprised at how often athletes come to Center for Creative Growth. And one of the biggest requests athletes have is just, how can they unpack to their parent that they just want them to show up? They don't want them to do anything fancy. They just want them to be there, but they don't want anything else. I've never been asked, how can you, Danielle, help me to have my parent better coach me? I've never in all my years, never had a request, because it never will come. They do not. Nobody needs that. Nobody wants that. They already have it. They have a coach.
Yeah. And Audrey, I think you're right. I have a son that coaches basketball, and I have a husband who reps basketball, but also a daughter who coaches lacrosse, and he also reps lacrosse. You do see it there too. And I'm curious. I know we have to wind this down, but I've been around the block. I've been around a long time. My kids are adults. the parent of today is different than the parent. I mean, I used to drop my kids off at practice. Now parents stay for practice. Like, what are you doing? Don't you have anything else to do? I'm curious. Is there something helpful we can be saying to parents, maybe even at the beginning of a year, that again, letting them off the hook? I love that you said that, Danielle, but just kindly letting them know that, like, your job of being a parent, I agree, is the most important job that you have there. Your kids are well cared for here, and they will continue to perform athletically. Basically they don't need your help there. But do you guys have any suggestions there for coaches that are out there listening? What are some ways to help manage this? It is a crisis. I mean, we get trained as coaches. We have to listen to these trainings on how to treat a referee because of the abuse parents give. They don't have referees anymore because parents are so abusive to them. The other thing that I'm curious about is that modeling good behavior for your kid? I mean, that's the part that's a little confusing to me, but I'm just wondering if either of you have any help for coaches out there to help navigate parent involvement.
Audrey, do you want to go?
Yeah, I mean, I've had really amazing coaches for my son, and I've seen the bad behavior from other teams. The reason why I think our team doesn't have bad parent behavior is because all of the coaches that we've worked with in 2 specific programs that we use in Chicago is the setting of boundaries and expectations, and also the coach's behavior. So they write out the parent expectations, and then they hand it out on paper, and then they also continue to have it at the bottom of every email of parent expectations, of athlete expectations and coaches expectations. And so I think the persistent boundary, the persistent expectations sets a culture, and then it sets a tone. And I find that our parents are ones who are more respectful, take a step back, because the coaches would then pull us to the side and remind us of it, and it wouldn't be the first time or the second time that we hear it. I find that there are programs that actually like the drama and like the competition because it's the culture that they've built. So parents have to just be mindful and take responsibility of the program that they choose. And if they choose a program that supports that and allows that, their child's going to become a product of that. So I think parents need to step back and really look at the program and the culture and understand the bigger pictures, developing a whole person, and that culture influence is significant. I would not choose a program for my kids that had any of that behavior, because I know that they would become a product of that.
Well said. And I know the research also does suggest that, when a coach loses their, emotional regulation skills, when they lose their top, it is not a sign necessarily of passion or that they care more or that they're more right about a call, but it actually creates immediate dysregulation for the athletes. That's their like home-based sound person who's supposed to be grounded, so that the athletes also can sit in their own dysregulation and know they can sit in it and it be okay. But you're right, with culturally the modeling of someone else is dysregulated, that's the representation of how they deal with it. Then I either can't feel what I'm feeling, or I'm gonna let it spill out onto everyone else. And it doesn't just end at the coach, it's definitely in the stands with the parents. When a parent is overkill, shouting, screaming, getting really, excited about something that they think is right or wrong, it doesn't show care or love in the way they intend, again, or even just trying to be right about a call. It creates a dysregulation in the team. And so we do have to be careful about that chatter. And the energy is contagious. It really, the energy exchange still applies here. The physics still apply. So I think always to remember that, from the coaches, that beginning point, what are you modeling? One thing that I often tell coaches is when I consult with coaches and they're like, I don't know what to do. Like parents, don't, necessarily agree with some of our practices or our training or this and that. And then they kind of want to play, Monday morning quarterback. I also, advise coaches, let them come into practice, but also dictate when that will be. And the reason for that is, again, in the research, it shows practicing under pressure is really valuable. And even though it's your mom or your dad or your grandma, your grandpa, your caretaker, and they're a fuzzy figure, maybe it still creates undue pressure, whether you want to people please or you want to show them up or you want to prove something. And actually having coaches take one practice a season and inviting all of those caretakers, all of those family members to practice for really hard practice to practice under pressure and having that be a contained experience so that, if you do get a crew of parents that really want to be there all the time, this is their moment, but it's also intentional. It's for the purpose of the athletes to better their ability to actually perform when it comes to game time or meet time.
It's so funny because we do that.
I love that.
Yeah, we have for a long time, we had the parents run the time trial with the athletes, which was hilarious and super humbling for the parents. So that was, and now we invite them in, after the parent meeting and they practice, yoga with us. So it's the same thing. We've been inviting them, to the entire time I've been with the program, we've been inviting parents to a practice just to get a taste of, what it feels like to be an athlete, what it feels like. And so, and also to get a sense of how we interact, in real time, with their kiddos. So I think that that's, super important. Audrey, I cannot tell you, I think we said we were going to be 40 minutes and we just ran 11 minutes over. So one of the tenets of being a good coach is being respectful of time and boundaries. So I am gonna first of all apologize, but also respectfully bring this to a close. This has been an absolute pleasure. It has been a wealth of information. I am so looking forward to going back and listening again and kind of retaking some notes. And I do want to give a gentle reminder that this is not meant as therapy. We are here to have open and candid conversations. That being said, we will make sure we put the link into Simple B counseling. So if it's something that you're looking at exploring or maybe something it is that you need right now, we'll make sure that we've got your information in there because you are definitely a wealth of information and an incredible resource. And we thank you so much for your time and energy. We also want to thank everybody in our audience for being here. We know that you have so many other podcasts you could be listening to, but you choose to come back here week after week after week. Remember, the simplest thing you can do for us is to give us a 5-star rating. It literally takes no time at all. And make sure you give us a follow. That way you know when our new episodes launch. One last thing we'll ask you is to make sure you're sharing with a female athlete or coach you love. Until next time.